Hello, Michael Griffith here. In this video, we will be walking through pit crew CPR and how it is performed in our system. Pit crew is an effective method to use when working a cardiac arrest, especially in the out-of-hospital setting when multiple resources are needed to coordinate efforts. As you can see, Position 1 is performing CPR while Position 2 is preparing the monitor. Please note that for the first few minutes of the arrest, the providers will perform continuous chest compressions to allow for the setup of equipment resources. After the first rhythm analysis, the providers will begin 30 compressions to 2 ventilations. Position 3 is at the head of the patient and is working on establishing an airway. Position 4 is also at the head of the patient and will help Position 3 manage the airway. If additional personnel are available on scene, you can rotate them through Positions 1 and 2 as needed to prevent fatigue. We will now be placing the initial pads in the anterior lateral or standard pad placement. This can be easily accomplished by following the pictures provided to you on the Zoll pads. The red pad is placed on the anterior portion of the right pectoral, and the purple pad is placed on the lateral aspect of the left chest. There are 5 critical components to high-quality CPR. Minimizing eruptions and chest compressions, provide compressions of an adequate depth of at least 2 inches, provide compressions of an adequate rate between 100 and 120 compressions per minute, avoid leaning between compressions to allow for proper recoil of the chest, and avoid excessive ventilations. Performing high-quality compressions is a full-body activity. As you can see here, this provider is able to deliver high-quality CPR by positioning his body correctly. First, he is hinged at the hip. This means that he is bent over but still engaging his lower body to assist him in movement. His shoulders are positioned directly over his arms, which are locked out in a stacked position. This means that his elbows are not bent. This allows him to utilize his entire upper body, controlled at the hips, for compressions, which assists him in delaying his fatigue. In this position, he also has much more control over how much he leans into the compressions because his lower body remains engaged. Last, he will find it much easier to adjust his rate of compressions if needed because his entire body is engaged in the activity. You will see that they are performing 30 compressions and pausing to deliver 2 ventilations. You will notice that when the monitor prompts the crew to stop for a rhythm analysis, CPR is stopped regardless of where they are at in their cycle. 30 and 2 assists in less provider fatigue because you can swap out compressors for each round of 30 compressions if needed. Ventilations in 30 and 2 should only be given during a pause in CPR, and a one-hand bag squeeze is recommended to prevent overventilation. The intervention paramedic is responsible for performing all ALS procedures needed during the resuscitation. There is no specific requirement for where this position needs to be placed. However, we recommend it be in a location that allows ample space for all providers to perform their activities and swap out positions as needed. The co-commander is the position that conducts the cardiac arrest and keeps the team on track with interventions, pulse checks, rhythm checks, and any other necessary activities. In our system, this position will be someone on the fire department. It's important to emphasize that the co-commander and the intervention paramedic are not the same person. As you can see, the co-commander is calling out reminders for pulse checks and rhythm checks.
About 1 minute left until next rhythm check.
As well as reminding the intervention paramedic what medication should be given based on shockable and non-shockable rhythms. They are also ensuring that end-tidal goals are being met and documenting what interventions are being performed when. There are 2 resources that the OMD has developed for the co-commander to utilize. We have a paper option and an electronic option. In this video, the co-commander is using the image trend tool, which helps to remind him of what is needed throughout the arrest. As procedures are being performed, he is able to document them in his PCR. We have recently optimized this tool to fit the new protocols and through provider input have focused on making this tool relevant to only cardiac arrest activities and easy to use while on scene. No matter which agency you work under, you can access this tool in Image Trend within the situation panel on the right side of your screen. This tool is set up the same way across all Image Trend agencies within the system.